Welcome back, everybody, to Wellness right here on Wood TV Plus. And joining us once again from Grand Primary Care, it is Courtney Smith. Courtney, always a pleasure having you on today. Thank you so much for stopping by once again.
Yeah, thanks again for having me.
Of course, and as lovely as it is to have you back on, we are talking about some pretty important and less lovely topics, I think, today. And that, of course, is stress awareness and also alcohol awareness. Again, that is two big months that are happening for the month of April. Again, it's Stress Awareness Month and Alcohol Awareness Month. But again, these are conversations that, aren't just to be had in April. They're to be had really all throughout the year. I want to start off by talking about stress, Courtney. I feel like these days, I can't just be the only person that feels like we're a more stressed out society over the past couple of days. Is that something that, we can kind of quantify and say that, yes, we are a little bit more stressed out these days? And if so, why is that the case?
Yeah, absolutely. It can be quantified. So the World Health Organization estimates that anxiety disorders are the most common mental health disorders worldwide. And in the United States specifically, estimated that around 30% of adults will experience an anxiety disorder at some time in their lives. And this is so important to name and talk about chronic stress, where it comes from, and to talk about anxiety disorders and how to treat them.
Mhm. And Courtney, one other thing that I also really want to touch on is anxiety. You had said that, and I feel like we use these words kind of interchangeably, but I also feel like maybe they mean different things. If we could kind of just talk about the differences, if there are, between stress and anxiety, and really why maybe we feel a little bit different, or maybe why we feel like maybe they are kind of the same.
Yes, you're right. Stress and anxiety are used interchangeably, conversationally, but they are different things. Stress is an emotion, stress is a feeling and a state of being. And stress can be good, it can be neutral, and stress can be bad. So,
Mhm.
some examples of good, productive types of stress would be like the progressive overload that we use when we're lifting weights. So that's a good way that we stress our muscles and it leads to growth. Bad types of stress, unfortunately, cause negative results in the body, and chronic stress over time can lead to anxiety disorders. Anxiety disorders are a medical diagnosis, and so that would be something that's administered by a licensed healthcare professional, a
Mhm.
mental health professional, your primary care provider, or a psychiatrist. So that's a diagnosis.
Right. So we might be feeling stressed out, or maybe we have those anxious feelings. But to say that we maybe have an anxiety disorder, that's something that, again, you kind of have to go see a medical professional or somebody who maybe has a little bit more understanding about that to really be, say that you have an anxiety disorder, correct?
That's right.
Absolutely. All right. Well, and again, another word that we've been hearing a lot, well, kind of associated with stresses and anxiety disorders is this feeling of burning out and feeling burnt out and kind of just not really wanting to maybe do these other things, or feeling like I can't keep doing this same routine, this same task at work, this same part of my life. I don't think I can keep doing that. How do we know, though, when we've really hit that burnout phase? Because, again, there are those times when I feel like I don't necessarily want to do something, but I know that I can. And if I really want to kind of set my mind to it, I can. Burnout, a little bit different. I mean, that's a really serious part that if you do hit that side of it.
Yeah, Phil, you touched on a few really important differentiating factors. You mentioned specifically at work. So, burnout is defined as a work or professional related experience or
Mhm.
phenomenon. It's not a medical diagnosis, so not a clinical term, but it is a very real phenomenon. You also mentioned not wanting to do something or like a lack of motivation. And lack of motivation can be due to multiple different things. Burnout certainly would be one, but sometimes is affiliated with an anxiety disorder, could be related to
Mhm.
ADHD or a depressive disorder. So I think this touches on a really important point, which is that if someone is finding that on an ongoing basis, they're really struggling with something, it's really important to discuss it with your healthcare professional so that they can help kind of tease apart those finer differences to determine really what's going on under the surface. But speaking about burnout specifically, so there are three characteristics of burnout. One is a feeling of exhaustion or overwhelm.
Mhm.
The other is a feeling of cynicism or increasingly negative thoughts or feelings about one's work. And the third is a lack of professional efficacy. So, feeling like you're being less efficient at work, not getting as much done professionally, or feeling down about your professional skills. And burnout is becoming, unfortunately, much more common in the US, and is contributing to people leaving their jobs or moving jobs kind of frequently. So it is a big problem professionally.
And I feel like we all maybe know somebody that's experienced a burnout or at least have felt like that. And, maybe even ourselves have kind of hit that point as well again. But I think it is kind of interesting to know that these really are all just interlocked with one another. The stresses of life, the anxieties, the burnout feeling. I mean, again, it all kind of leads up and it can leave people wondering, when should I be getting help? Because again, I feel like there is this belief in society right now that, okay, I need to be strong. I know I can do this myself. I can handle it. I know I've done it my entire life. I can do it. But when should we really be considering going to seek help? Because sometimes the strongest thing to do is to ask for that help.
Absolutely. So we mentioned that stress is an emotion and we all feel stressed sometimes, but it really shouldn't be the dominant or persistent emotion. If you're noticing that you're feeling stress or overwhelmed or worrying excessively, feeling more irritable, and it's a really persistent feeling, and it hasn't improved or gone away, that would be a reason to go see your healthcare professional. Also, if someone else close to you brings it to your attention, so a significant other, a close colleague, a family member, if they say, "Hey, you haven't been acting like yourself, I just want to check in with you," that can be an important sign. Sometimes we're so wrapped up in our own day to day or struggling with whatever is going on in our head that it's hard to pick up on those themes. So if somebody close to you brings forward concerns, we should take that seriously and perhaps go seek help.
Absolutely. And of course, you will obviously get the help from, a medical professional, a psychiatrist who might be able to assist you in some of this stuff. But there are also other ways to help reduce stress. Courtney, if you wouldn't mind maybe just kind of going over some of those really most effective stress reducers that, again, maybe don't bring along some additional issues associated with them.
Yeah, there you alluded to there's some healthy ways that we can alleviate stress
Right.
and some less healthy ways. So, specifically speaking to burnout first, sometimes it can be helpful to set firm boundaries with work-life balance, however you're able. Also, making room for some of the healthy lifestyle modifications that we know can be helpful to alleviate stress, like carving out time for physical activity and trying to make sure that you're getting enough sleep, trying to consume a healthy diet. More broadly speaking to stress and even to anxiety disorders, there are a number of studies that have indicated that cognitive behavioral therapy can be really helpful for anxiety, even as helpful as medication, and leads to more long-term success with managing anxiety disorders. And of course, fewer side effects, right? If we're going to therapy, maybe in lieu of an additional medication. So, cognitive behavioral therapy is a great place to start. Trying to consume a healthy overall diet, so increasing fruits, vegetables, whole grains, minimizing highly processed foods, fast foods. We know that aerobic exercise can be as effective in managing stress and anxiety as therapy and medication, even, which I think is remarkable. So, just a reason to prioritize movement. And movement can be aerobic exercise like walking, running, biking, swimming, but it can also be lower impact activities like Tai Chi or yoga can be very stress relieving. Some other lifestyle changes that can be really meaningful to minimize stress are trying to spend more time outdoors in nature. We're coming up on a season in West Michigan where it's a lot more practical and enjoyable to be outside. So if we can over-index on that this time of year, that's a good thing. Also participating in creative endeavors, whether that's creating art, drawing or painting, singing can be helpful to alleviate stress, and seeking out beneficial social connections. So engaging with friends, going out, meeting new people can also alleviate stress.
Right. No, and I will second that walking aspect to it. I mean, especially here in West Michigan, we've been waiting all winter long, really, to be able to enjoy the outdoors again. And, we're starting to hit that point. And I got to say, it may seem like an easy solution, but really just, 10, 15 minutes walking after work, before work, it really does make a huge difference. Another way that a lot of people seem to be turning to stress, some people might be turning to alcohol a little bit, maybe an after work beer every now and again, or, a couple of drinks here and there. And I feel like that's because it's been ingrained a huge part in American culture. And that's kind of where I want to turn this conversation now, Courtney, into talking about Alcohol Awareness Month in the month of April. Again, a huge part of American culture. It's been that way for a very long time. But, we had kind of been messaging back and forth before this interview. And you had also mentioned that kind of anecdotally, and even for myself, I can speak to it, that a lot of my friends as well, they haven't been drinking as much. I feel like there is this kind of shift away from the drinking culture. I just kind of wanted to see if, you wanted to explain a little bit more about what you've been seeing particularly.
Yeah, it's very exciting and encouraging
Hmm.
that I mentioned anecdotally that I see a large percentage of my patients who either don't drink at all or drink very, very infrequently, like at special occasions. And that really has not been the norm in American culture. So we have data even as recent as like 2023, 2024, showing that unfortunately some of the diseases and fallout from or related to alcohol use have been on the rise.
Hmm.
Alcohol-related deaths in the US have been on the rise for the past several years. So it's possible that the data just hasn't caught up with some of like what I'm picking up culturally
Hmm.
in West Michigan. But yeah, that's a big change that's happening here. We see even founders coming out with some non-alcoholic beverages, and
Hmm.
those are becoming more popular. That's really a good thing health-wise.
Hmm. And we've seen, the dry Januaries, I think, have been becoming more and more popular to really kick off the New Year's as well. But, kind of going back to that, why do you think that is, though? I mean, do you think it's maybe because people are becoming a little bit more educated about those risk factors associated with drinking alcohol? I mean, maybe do you see maybe why, or maybe have you heard why people may be turning away from alcohol?
Yeah, I think a combination of multiple factors. One, there has been increasing awareness of long-term negative health outcomes associated with alcohol use. Even mild to moderate alcohol use can increase the risk for some really scary types of cancers. Breast cancer, of course, lung cancer, head and neck, esophageal, liver cancer, not to mention problems like elevated blood pressure, hypertension, type 2 diabetes, heart disease, cirrhosis, which is chronic liver disease. So, for a long time, we've known that alcohol use can cause health problems.
Right.
And of course, binge drinking can increase the risk for health problems as well. So I think an increased awareness for sure. Also, alcohol use can become a budget item. So alcohol use, similar to smoking, like it can be an expensive habit. And as budgets get squeezed, that can be one area where people feel like they can scale back, and it actually is better for them overall to scale back on that. There are also some other habits that are unfortunately on the rise culturally. So, like sports betting and vaping,
Hmm.
perhaps might be taking over some of the people who would otherwise be engaging in alcohol. But I'm going to take the good news of people drinking a little bit less lately as a
Right.
very positive thing.
Yeah, no, the glass is half full for sure. Let's hope
Mhm.
for that. But yeah, again, kind of why we wanted to mention just some of those more effective stress reducers, because again, we don't want people to necessarily turn to something else that could cause them harm, and maybe find that avenue that gets them the help that they need in a way that doesn't, again, impact them in a completely other unforeseen way. And I think that is something I want to touch on, because I feel like we hear a lot about, and we've even had conversations on Wellness on Wood TV Plus about in past episodes about smoking and how the dangers associated with smoking. And I feel like, as much as I have learned about it in the past, but I feel like we don't really spend a whole lot of time talking about the risk factors associated with drinking. And I feel like that might also be kind of why it might be difficult for people to say that, oh, I am abusing alcohol necessarily, because, oh, I only have a few drinks on the weekends, or, only Thursday through Saturday am I drinking. I mean, those, even just doing that, I mean, that can still lead to some issues down the line.
Absolutely. Yeah. Like I mentioned, even mild to moderate alcohol consumption over the years increases risk for a host of really serious medical problems, including cancers. Maybe this is a good opportunity to define alcohol use disorder as opposed to kind of casual alcohol consumption. But alcohol use disorder, which is a medical diagnosis, is characterized by the inability to stop or scale back on consuming alcohol despite negative consequences. And these consequences can be social, such as missing an important event or bowing out of an important event because of alcohol use or intoxication. Sometimes these consequences can be professional. So if we're missing work or decreased workplace efficiency because of alcohol consumption, some of the fallout from that, it can cause legal consequences. Of course, some people can get into legal problems related to alcohol use. And sometimes even despite these kind of bad things happening, people still have a hard time scaling back or a hard time stopping. And that's what defines alcohol use disorder, which is kind of the umbrella term now for alcohol abuse or alcohol dependence or alcoholism.
Right. And, again, I think there are ways for us to maybe help each other out a little bit more. And so I guess the next question for you, Courtney, is what are some of those signs that people should be kind of on the lookout for when it comes to people and their alcohol use? Just to, again, you don't want to overstep, and we don't want to kind of demonize people that are drinking alcohol, but we want people to be at least aware of when it might be becoming a problem for somebody and help them get the necessary help that they might need. So again, at what point, or what are some of those signs that we should be kind of on the lookout for?
Yeah, these are really important questions to perhaps ask ourselves if we're thinking about our own alcohol consumption and trying to determine, like, hey, is this a problem or not? So one way to check in with yourself is, like, are you concerned? Are you concerned about your alcohol consumption? If you're concerned, then that's possibly a warning sign. Two, has anybody else brought it to your attention? Has anybody else asked you about your alcohol use or expressed concern? And how did that make you feel? Did you feel annoyed or irritated or defensive when that person asked you about it? That's a warning sign. Do you feel bad? Do you feel guilty or negative about your alcohol consumption? Oh, another warning sign.
Right.
Have you ever turned to like first thing in the morning drink or shot as what we would call an eye opener to alleviate a hangover or to alleviate stress the morning after consuming alcohol? That would be a really concerning sign. So these are all ways that we can check in with ourselves or check in with our loved ones gently to try to assess, might I have a problem? Should I talk to a medical professional about this?
Right. No, and again, I'm glad that you mentioned, if somebody had mentioned something to you, if we were the ones that maybe are having an issue with alcohol and somebody had mentioned it to us, like saying, hey, your things have been changing. Is everything okay? I think, there are people that are kind of worried about making that first step and kind of bringing it up to somebody. But again, that might be kind of what somebody might need to actually go ahead and seek that help. So again, even just mentioning it, there are, I'm sure, better ways of doing it than maybe just attacking somebody right away to kind of bridge that conversation. But again, just the importance of having that conversation is something definitely wanted to highlight once again. And that kind of leads us to the final question I have for you, Courtney, is, when should we be seeking help, whether it's for ourselves or when should we maybe getting other people into some additional, rehab, for example, just some additional help to handle those things that they're kind of going through? And also, what do those treatments kind of look like for people who might just have trouble controlling their alcohol usage?
Yeah, so if you have any doubts at all about if you might have concerns about your own alcohol consumption, or if you're not sure if you should do something different, ask your healthcare professional. Your primary care provider is a great place to start, and they're well equipped to have these conversations with you, asking some of the same questions that I already mentioned about kind of how to check in with yourself and assess the level of alcohol use. So when you're talking to your healthcare professional about it, there are ways that we can intervene to try to either make it easier to cut back and scale back on alcohol or help someone stop altogether. There are some like non-medication strategies. So I mentioned cognitive behavioral therapy during our conversation earlier about stress and anxiety, but cognitive behavioral therapy can be helpful. Oftentimes, not all the time, but oftentimes alcohol use disorder can coexist with mental health problems like anxiety or PTSD or depression, sometimes even ADHD. And so it's really important to be getting help for the underlying mental health condition while you're trying to scale back on alcohol. Sometimes social supportive groups like Alcoholics Anonymous or Smart Recovery can be helpful as well to help people maintain sobriety and prevent relapse. Uh, your healthcare professional will also talk to you probably about medication options. So there are some generic FDA approved medications that your primary care provider may be comfortable prescribing that can help decrease cravings. They can help alleviate some of the anxiety symptoms that might come along with decreasing alcohol use. There are even some medications that can make people like physically sick, can cause really like severe nausea and vomiting if you were to consume alcohol while you're on that medicine. So there's a variety of options depending on the overall situation. And I think it's really important to also talk about if someone has been a pretty heavy alcohol user for years and years, it can actually be dangerous to abruptly stop. And this is because alcohol withdrawal syndrome can occur, 12 hours to even like a few days after the last drink.
Hmm.
And sometimes the symptoms are pretty severe. Like that can lead to seizures, it can lead to really significant like fluid and electrolyte imbalances, can lead to arrhythmias or like problems with the heart rhythm. These are really dangerous problems, and there are ways that your primary care provider or your healthcare professional can intervene ahead of time. So sometimes we can prescribe anti-seizure or anticonvulsant medication to be protective for someone while they're cutting down or quitting. There are also some supplements that can be helpful to add while someone is cutting back as well. So, really important to have a conversation, ideally before you abruptly stop drinking, just in
Hmm.
case you could benefit from some of those protective factors.
Right. All right. Well, Courtney, again, these have been such important topics, and I'm glad that we're able to talk a little bit longer about them both today. Any final comments, anything really that you want the viewers to kind of know, whether it's about ways to reduce stress or just stress awareness in general, or again, the alcohol abuse awareness?
Yeah, with stress awareness specifically, I hope people feel empowered and comfortable talking to either their primary care provider or their mental health professional about their
Hmm.
symptoms, being very open and transparent, knowing that we have a wide variety of medication and non-medication ways to intervene to try to help you live your very best life with the most balanced and healthy mental state possible. And regarding alcohol use, I hope people know that we don't have to consume any alcohol to live a happy, healthy, fulfilled life. Yes, it's part of American culture, it's really ingrained in society. But don't be afraid to buck some of those societal trends. If you're feeling a pull to do something healthier with your lifestyle, I hope you feel empowered to scale back a little bit. And if you feel like you're in one of those categories of people that might benefit from pre-planning with your primary care provider, please bring it to our attention. We are so happy to help people make important health changes like that.
Courtney Smith with Grand Primary Care. Courtney, always a pleasure. Thank you so much for stopping by today. We'll see you again next time.
Yeah, thanks for having me.
Of course.